Personally, I would just like to take an opportunity to give a shout out to one particular delegate who they were the first on our delegation list, Stuart Kalinza. Stuart brought this issue of heat and health to my attention a number of years ago, and there began my deep dive looking into the coroner's report in British Columbia, reading about the history of Chicago, looking at what happened in Quebec. I think part of the challenge has been we think of Canada as this cold climate when we know that heat is deadly and it is having an impact. And to Councillor Beatty's question and Councillor Clark's comments, we know, and is affirmed by our doctor of public health, is elderly people retain heat longer, and their glands do not work the same as you and I, and this is confirmed. For those folks who would like to read it, Harvard Medical Institute. Doctors have known about many risk factors for decades, and others are emerging. By applying statistical expertise to vast healthcare and meteorological data sets, they have been uncovering previously unappreciated conditions that raise older people's likelihood of being hospitalized during and immediately after heat waves. These findings were first reported in the Medical Review in 2014. So that data is there. The costs are real. And to Councillor Beatty's point, couching it in cost avoidance, I think, and emergency costs that are being supplied to try and deal with this is, I think, an important perspective to take as we move forward on having to deal with a lot of these climate-induced emergencies. So I really appreciate those comments and Councillor Clark's comments about his commitment to this and trying to tease out the real health impacts. And we know that Hamilton has a higher proportion of those who are defined as seniors. We know we have per capita more people who living with disabilities, and has been referenced, we have code neighbors that are particularly challenged on a whole bunch of fronts, which makes them vulnerable. So I just wanted to thank Stuart for bringing this to my attention. It's something I ran on and remain committed to. Thank you, Chair.
Thank you, and you could have the chair back.
Thank you. There are no further comments on this issue, and I think we are going, if I have everything in an order, yeah, we can go to an adjournment.
I think maybe we should just receive the report, just because there's been conversation after the main, after Councillor Cretch's motion.
Thank you. It's moved by Councillor Clark and seconded by Councillor Cretch to receive the report. Thumbs up for me. Carries 9-0, and it's moved by Councillor Kazara, seconded by Councillor Beatty to adjourn, please. Thumbs up for me. Thank you. That carries 8-0, and I'll see you, most of you, at 1:30.